Hello, this is Anne DeGheest. Welcome to the Anne Insights channels on YouTube. First, I'd like to thank you all my supporters who posted my videos of October the 9th, and we have reached over 1,400 viewers. This week is going to be even more important that I get your support. Unfortunately, the US now has reached a point that it's its worst daily cases ever at over 75,000 cases per day. And we also have a lot of information with two videos this week. The first one is on epidemiology, which is showing how the virus is spreading in Europe and a lot of lessons we need to learn. For the US, we're going to do a deep dive in the US and what's happening at the state level. And also we're going to discuss the future of the workforce post-COVID and what could be some of the changes happening to all of us. The second video is going to be very important too. We're going to review all the different treatments if from a preventive point of view, if you have a mild cases at home, and if you unfortunately end up in a hospital with a medium to severe case. So please help me again. We really need to reach out to as many people as we can to stop the spread of this virus. Thank you so much for your support. Hello, this is Anne DeGheest. Welcome to the Anne Insights, October the 23rd. This first video is going to be about the epidemiology, and there's a lot to talk about this week. Unfortunately, today was big news. It just literally came out a few minutes ago. We have now the worst day ever at 79,000 cases per day, which was the highest in the history of the US. We're going to talk about the India is having a major drop. That's good for them. Unfortunately, Europe is absolutely exploding. You can see here it's going at a faster rate than the US, but the US is now starting to catch up. The death rate is around 1.1 million people in the world, and 42 million people have been confirmed with the case. At the end of this first video, I'm going to discuss how the future of the workforce will look after COVID, based on an HBS seminar that was really interesting. Do not miss my second video, because we're going to do a review of all the different treatments. If what you can do if you are asymptomatic or have low mild cases at home, as well as how the protocols are in the hospitals if you have medium to severe cases. So where are we? 42 million cases worldwide, and we're growing at a higher rate. 2 weeks ago, we were growing at 350,000 cases. Now we're growing at 445,000 cases. That's a massive increase. So unfortunately, it's still accelerating worldwide. You can see the curve that was kind of tempered down during the summer now is going back up. We have 1.1 million deaths in the world, and that's, as we all know, probably underreported. The US, unfortunately, is still leading the world. So at the lowest in the summer, the US was around 34,000, around here. And unfortunately, now we have just reached 79,000 cases today. India, you can see, is doing a great job at dropping it. And we're going to spend quite a bit of time today on Europe, because Europe is a predictor of what is going to happen to the US. So I think it's really important we act upon it. On a worldwide basis, you can see that the US is 20% of the cases. India is going to, was on the path to catch up with us, but now they're going down. So maybe they will never pass us. The US will stay ahead. And then Brazil is also slowing down. So East versus West, a very interesting analysis. If you look at the EU, you can see the EU has exploded. This is the only term I can use for this one, significantly higher than what they had in the spring. You can see that the US really is the first peak, the second peak, and now we're back to the third peak. And as of today, it's probably going to pass it over here. And East Asia is the dark red, pretty much has it under control. And Southeast Asia is pretty much also controlling it. And you can see this on the normalized basis on the number of cases or deaths per million. It's interesting to discuss because Asia has 33% of the worldwide population, but they only have 20% of the death. They have a culture where it is totally acceptable, if not desired, to wear a face mask if you believe you may be contagious. To give you an idea, in South Korea, they did a survey of the population where 85% of the population was afraid to catch the virus, so therefore they were willing to wear a mask versus 58% in the US. They're also much more aggressive in having teams like a SWAT team for surveillance. They do tracking of your credit card. They do tracking in the TV in the streets. They give you a QR code on your phone that will allow you to get in and out of certain areas there or be able to travel. They're very aggressive in testing, tracing, and they're very strong travel restrictions there. There's unfortunately areas there that we're not willing to do in the US. And you can see as a result of that, China now is growing again. And unfortunately, the rest of the world is in a negative growth rate. So looking at all the worldwide serious cases, and remember, most of these are underreported. You can see for a while we control it, but now it's going straight back up. So let's take a look, deeper dive at what's driving this. India, great news. They somehow have managed to control this. We have to see how accurate the cases reporting are, but that's a massive drop in the number of cases, pretty much dropped by close to half. Unfortunately, US, we're clearly going into a third peak. And whoops, computer is being slow today. In Latin America, we are underreporting a number of cases. And the way they look at this is that you look at the excess deaths. The excess deaths is the true mortality compared to what the historical average should be for that time of the year. And you can see, for example, in Mexico, that it's probably underreported by a factor of 50%. And Brazil, Peru, and Mexico have been big drivers of the mortality in Latin America. Israel is having a massive rise that was driven by the opening of the school. And they are now in a second lockdown. What is very good for us to learn is that their second lockdown was extremely effective. You can see how quickly it dropped. And the same thing on the number of deaths as well as the number of cases. So the second lockdown went from 8,000 daily cases to less than 1,500 in a very short period of time. And it is believed that because people were willing to wear masks, they banned all the large gathering. The Orthodox were really, the ultra-Orthodox were really driving the contagious rate. Part of that is they live in higher density housing, and also they were a bit resistant in wearing the mask. And you can see in the first wave, they had a contagious rate that every person was basically infecting 7 people. With the second lockdown, they now have a drop from 1 to 0.6. So this is an interesting data, which is over 50% of people were contacted by the case trackers in Israel were lying and refused to share who they had been in touch with. And that's a fundamental approach. There has to be a trust system where people are willing to share who they may have infected so we can contain those cases there. And even the people who were being approached saying they may have been exposed during that period of contagious, 30% of those refused to be tested. So we absolutely need to change the culture and the environment. Let's look at Europe. These are the cases. You can see France significantly higher at the peak that they were here in the spring. UK, Spain, Italy, Belgium, Germany, pretty much Europe is lighting up like an iron rod. It's very concerning there because it's all linked to reopening of the school, and pretty much Europe is 1 or 2 months ahead of us. So this is a very big concern that we all need to step in and really change our behavior in the US. And I do need your help to please post these videos. Let's look at the search. Czech Republic is having a massive case. This is the important numbers. Number of new cases per million, absolutely exploded there. Belgium, which had one of the highest mortality, has a major upsurge, and they're pretty much in curfew after midnight, and they've restricted bar and restaurants and a lot of things. They can only meet like, I think 4 people per week. But you can see it's all of Europe is really exploding there. Positivity rate, the Holland, which was very similar to Sweden, which is, we don't wear masks, we just get the herd immunity. They have now over 25% positivity rate. That means it's rampant for the community. Ukraine is having a major swing, even Belgium, Switzerland, the whole is there. These are very, very high number. They had managed to get a really low rate of positivity rate in the summer, at 2 to 3%, which is how you control the disease. Unfortunately, with the summer holiday, people went to Spain and other location, and they basically brought it back to the rest of Europe. An interesting question is the mortality following, or is this a less fatal mutation of the disease we're dealing with. And remember, there is a delay. There's a delay where what we have shown in Israel 2 weeks ago is that first the younger population was getting the disease between 15 to 25 years old. Then a couple of weeks later, so you start having an increase in the 25 to maybe 45 years old. And then you had the third wave, which is the elderly, the grandparents who get exposed. And I think we start to see this because it's the older population that's getting hospitalized, and you see that delay that happened there. So the next few weeks are going to be critical if we see a mortality going back up in Europe. And the first sign is hospital admission. And it's, rising up again in a dark red is the outbreak accelerating. And you can see that in Belgium, it's going straight back up. The Czech Republic, which had this big outbreak, is also vertical there. France has the same problem. They have now a curfew after 9 p.m. at night. And Italy, that was hit really hard there. So we need to keep an eye on that. But it's really important in the US that we learn those lessons there because they are a predictor of what may happen to us. Interesting lessons. If you look about who got hit the hardest in Europe, you could have said, well, maybe it's the other people, the people who didn't get exposed the first time. This is fascinating. The people who got hit the hardest in the spring are the people who are the worst stuff right now in the fall. And fully understanding why, I'm not sure we have all the reasons yet, but it is a very strong indicator that, the herd immunity isn't there and the spread is happening in the region that got hit the hardest. So an analysis show, if you look at the cumulative death per million, so it is normalized versus the fall in GDP, that the people who had the most deaths had the largest economic hit. And this is one of the problems in the US. We have this belief that if we just focus on the economy, we can basically just not worry and get the herd immunity. What this is showing is exactly the reverse, is that the economy is linked to the death rate. Yet people are really afraid when there's a high death rate, and as a result of that, you have a higher shutdown. And you can see that in this red block here. The US, unfortunately, is in the lower right quadrant there, which is not where we want to be. And of course, you see a lot of the Asian countries, Vietnam, China, Korea there, who have done a really good job at controlling the mortality and having a minimum impact on their economy there. Clearly a correlation here, that's a reverse correlation, and basically talks about the fact that we need to control the clinical outcome in addition to the economy. For the fun of it, I look at the plague in 670 years ago. What were you doing differently? Because human behavior is the problem we're having in the US. And what happened with the plague is that people were going from getting the first symptoms to death in 4 days. It was significantly worse than COVID. Even animals were dying. To give you an idea, Florence lost a third of their population in that period of time. And what they did is same thing we did. They closed the border. Guess what? It did not work. They had cities in near lockdown, and they closed all the hotels and restaurants and bars. Sounds familiar. They had conspiracy theories. It was all the people were different. So people went after minorities and Jews and other people who looked different. And at the end, the response that worked is you stay at home outside the city, isolate yourself. They were using herbs and spices and fancy masks to basically try to protect themselves from what they thought was the contagious part. And the people who got in trouble there are the people who were drinking and socializing. Sounds familiar? Nothing has changed in 670 years. It's all about human behaviors. Wearing a mask is therefore essential. And you can see the big difference in Europe. The area there in Sweden and all of that, they are not refusing to wear masks. Same thing that happened in Holland, which is why having that big spike there. Where the countries that got hit in the spring there are much more protective of themselves wearing masks. So the Europe is passing the US as a group. Unfortunately there, because they have a steeper curve, but you can see the US may be catching up with them again. Let's talk about the US. As of yesterday, we had 75,000 cases. As of a couple of hours ago, on October the 23rd, we now are at 79,000 cases. And the reason why that's important, because that means it's the highest ever. We are clearly back off to the race with the third peak that will probably surpass the prior history that we have had. We have over 222,000 deaths. So it's unfortunately accelerating. If you look about how many days it takes to get to an extra million cases there, you can see now it's 21 days. which means that we are probably going to hit 9 million, in the next 2 to 3 weeks. We are unfortunately, since we talked 2 weeks ago, the case rate has increased by 32%. And I pause on that because 32% in 2 weeks is an acceleration. And you can see the area there that's really the hot spot is a lot of the Midwest, and ironically, where we have a lot of the swing states for the election there. And so really worrisome for the next 2 weeks. The death rate, unfortunately, has also gone up. Remember, there's a delay of 4 to 6 weeks, and the death rate has gone up by 10%. The highest was 1,000. We're at 800. It's expected to go higher. So 2 weeks ago, we look at the peak, and you can see in April the 10th, we had a few peaks there, and then it starts spreading to the southeast, and then the whole Midwest lightened up on October the 13th. Let's see what happens now. Unfortunately, it's still the Midwest. The Midwest has gone up 33%. Here's the bad news. The South has not gone up 40%. So we're having that whole region lightening up. And we have even some increase in the Northeast by 10%, still one of the best in the country. This is a very sobering slide. It shows in which months and what week did we have the single day highest case record for each state. And a picture is 1,000 words. You can really see that a lot of the states are breaking their records, unfortunately, in the last week. A major change is that we started the epidemic in the large inner city, New York, of course, being the most visible one. And then it spread to the country, and now it's really going to the rural and small town areas. And it's clearly, linked to the population moving around and spreading the virus there. So a lot of the activity we're seeing right now is unfortunately an area that may not have great healthcare coverage in hospitals in case people end up needing ICU care. Winter is coming. And these are, I don't want to scare anybody there because we never know about prediction. These come from two different sources. One of them is being used by the US government for their prediction there. And what they're saying is kind of, they expect to go from 800 deaths per day to 2,000 deaths per day by mid-January. They expect the worst that's coming at us going to be the peak in January. They expect the mortality rate, if we do some type of control, partially in some states, could be around 386,000. If we don't and we ease too quickly there, could drastically increase to 450,000. Depending on the study, if we could get the population, 95% of the population to wear a mask, we could save between 60 to 130,000 lives, depending on the models there. So please, the lessons of this one is please convince your friends and your loved ones to wear a mask for themselves and to protect the people they may accidentally infect. This is a study that just came out, and it's really fascinating. If you look at the top 6 countries, the country that had the highest mortality in the spring, so looking at the March period there, and we had a mortality rate around 60 to 80 per 100,000. Europe went down drastically. They went across the board from around 60 to, 3 to 5. So a massive improvement in the treatment of patients there and decrease in mortality. The US did not. So you can see it's a factor of, it's a very significant factor for Europe to drop, like, Italy went from 60 to 3, and US, which is very similar, around 60 there, only dropped by half the mortality rate. And there's an analysis that was published by JAMA, which is a very credible journal in the US, that shows that if we could have the comparable death and the same human behavior that we have in Europe, we could save between 40 to 100,000 deaths. So the issue here is that they have the same drugs, they have the same procedures we do. It's just the behavior, and we really need to get people to take this seriously. Back in the red zone, these are the changes per state over the last 2 weeks since I saw you. And you can see, unfortunately, we're moving to the red zone. Red zone means it's an increase of over 50% on the average in the number of cases in the last 2 weeks. To give you an idea, overall, the US has gone up around 30%, but Illinois has gone up 80% with very large population rate. Michigan, Indiana, Ohio, Arizona, Wisconsin, Minnesota. These are all high population that I've identified. And of course, as you would expect, Florida. And then this is interesting, New Jersey is going back up. So it unfortunately is going back to the Northeast. We're very far from the herd immunity. Remember, the objective is to get to maybe 70%, and we are probably on the average at maybe 7 to 8% if we're optimistic across the country. Hotspot is shifting around. I put this graphic that we had on October the 5th to show you how it's really moving. We first had New York, and then it went to Florida and Texas, and then it went to the middle of the country. And you can see it's continuing to spread across the country. Some of the states, unfortunately, are not always reporting their data, but clearly it's the Midwest that's in this rural area that are being hit very hardest. Our testing positivity as a country is around 7%, but there are all those states here, which are significantly higher than that, including Florida, Texas, Virginia, there, who have a very high positivity rate above 10%. I want to emphasize that 41% of the deaths in the US come from 1% of the population, which are people in long-term care and in nursing homes. So please protect your loved ones. You can see the number of people who die who come from nursing home is really significant. It's on the average 30%, with some states as high as 70%. California, good news for people here is that we are one of the best states right now. Our positivity rate is 2.8%. That's fantastic. That's how we control it. You can see the number of cases is very steady, heading a low rate, and we don't seem to have been impacted by the surge yet. So please, please, please help us stop the spread. Wearing a mask is all over the map. The good news is that this was the map I showed on September the 28th, and you can see how in the last close to a month, we have had a massive increase of people willing to wear a mask. So that's the great news, is that people are now starting to take their steps. So we just need to continue that for probably another few months. Masking up, an analysis just came out. So it was done on Facebook by Carnegie Mellon. And they show a correlation of 0.73. And the correlation means that if you wear a mask, it explains 73% of the variability between state in the COVID prevalence. So very interesting data there. I've put the reference here. And the question they ask people on Facebook is that, what's the percent of you that know somebody who has COVID? And clearly it shows a measure of prevalence there. And it is pretty stunning, the relationship there. And so please wear a mask. I'm going to change a little bit the direction here, is to say what is going to happen to our world post-COVID. And if we look at who got hit the hardest with the COVID and the change in economy there, it's clearly the big impact where people who had a high school diploma or didn't have a college degree got hit the hardest was in the unemployment rate. So let's analyze this a little bit there. There was a HBS, Harvard Business School webinar, which done by Joe Fuller and William Kerr, two professors from Harvard Business School. And they predicted 4 scenarios of what's going to happen post-COVID. One is that we continue to do some type of digital distancing, so using Zoom, having lean organization there, but that means that the type of skill set we're going to be looking for in the workforce, people are really comfortable in this, what's called the digitalization skills. And there's going to be a dislocation of the lower skilled workers because they may still not be able to safely work in certain environment there. So there's going to be a lot of changes that organization are dealing with in the employee engagement alignment and what type of people we're going to be hiring. The second scenario goes up in the changes in the future, is that we're going to start hiring different people, and the type of the content of the job and who we're going to basically hire is going to be very significantly disrupted, especially in the white collar roles. The third is the bigger disruptions, and there's going to be talents of pools. And right now, people are much more virtual than the people in the geography. And we can see, for example, in San Francisco, we talked 2 weeks ago about the fact that there was a drop in the rental market by over 10%, because now you don't have to live next to your office there. So it's going to create a change in competition in the skill set and type of skill set. And there's going to be a major effort by company to reskill and upskill existing employee to enable them to be able to work in this new workforce. And it's expected the work practice will change. It's no longer going to be 8 to 5, Monday to Friday. There's going to be a lot of what's called flex time and different teamwork. So it will create opportunity to develop new digital tools, and the way we work may be very significant. And then the fourth impact is the biggest change, which is we're going to flatly change how we work. The type of people we're going to be hiring is going to be different. The work process is going to be different. All of that creates opportunity in being lean and mean, and changing the talent management and how we grow people there. So we should expect significant change in the future of the workforce. And how will that impact people? If you look at freelancer before COVID, they were already expected to be over 51% of the workforce in the future. It is expected that it's going to impact a lot of what's called the back end, the IT operation, innovation, R&D. We're starting to move more and more into freelancer and what's called the gig economy. That is expected to accelerate. You can see in a lot of the hiring in the high skills is expected to go up by 50%, and middle skills which is also growing up. What it means is that they expect a squeeze of what they call the middle skill market. And these are people who may not have a college degree, and they may not have all these digital skill sets that people are going to be looking in the new workforce. So the hard skills is going to be more and more in sub-silos and high demand and across the country instead of the geography. And the low skill, the essential worker are still needed there, but the squeeze may be in that middle market. So it is expected there's going to be what's called digital inequality that may fuel unemployment. To give an idea, 18 million of households in the US don't have internet access. Well, if you have to work from home from the internet, it's going to have an impact. 32 millions of Americans don't really know how to use a computer effectively there. So we need to retool and reskill those populations there. And so please vote. These are pictures of the early voting that's happening across the country. We need your help. Please spread the word, and thank you for listening to this video. If you're interested in learning more and see my prior video, we have on the YouTube the links to PDF you can download. One is showing all by index, all the different subjects there from the prior videos. And then for each video, there's a topic time index that one of my followers is wonderful at putting together there. So I'm putting this, please download them, and you can go backwards on certain subjects. Thank you so much, and see you in 2 weeks.